Welcome to Season 1, Episode 4 of the Home Health Care Today show. It's March, and in March, we focus on multiple sclerosis, education, and awareness. With that being said, we have the pleasure and the distinctive honor to be a visitor today with the Michigan Institute of Neurological Disorders. The Michigan Institute of Neurological Disorders is the area's leading provider of comprehensive neurological care for the full range of injuries and disorders of the brain, spine, and nervous system. MIND has been around since 1969, serving Metro Detroiters. On our panel today, we will be speaking with Sonda Rossman. Sonda is a licensed counselor. She was diagnosed with multiple sclerosis in her 20s. After getting past the shock of this diagnosis, Sonda made the decision to help others afflicted by the disease. She started this mission by joining MIND over 20 years ago. Most recently, in 2020, she was asked to give testimony in front of both the State House and Senate that helped to pass Senate Bill 809. Which has alleviated the financial burden on patients who receive infusion therapies for many medical conditions. In addition to talking to Sonda today, we're going to also speak with Sarah Johnson, who is a nurse here with MIND, and we'll wrap up our interview with the newly appointed CEO of the Michigan Institute of Neurological Disorders, Mr. Kevin Browett. All right, but for starters, Sonda, welcome and thanks for joining us today.
Thank you, Cleamon. Great to be here.
Sonda, please tell us a little bit about yourself that I might have missed in the overview, and then take us back a little bit to that initial diagnosis and some of your thoughts and ideas at that point in your life.
Yeah, so I was 20 when I first had symptoms. I lost vision in my right eye, which was devastating, and no explanation, but this was in 1991. So that was quite a while ago at this point. And at the time, I was actually seen here, but a diagnosis of multiple sclerosis could not be made, and it really didn't matter at that point because there were no treatments available.
Yes.
The criteria, though, was very different to diagnose. MRI was more, starting to become more utilized in diseases, but it wasn't the sole sort of answer. So I basically had to wait until I had a second set of symptoms in order to be diagnosed, which occurred in 1996, about 4.5 years later. My vision did recover, but then the left side of my body went numb, continued, and I had some weakness, and I still have some sensory deficit from that. But that's what solidified the diagnosis. And then at the time, though, at that point, there was one treatment available. It was a suboptimal treatment, but it was something. And a few months later, we knew a second treatment would be available that seemed like a more suitable treatment for me in terms of how often it was administered, and then the side effect profile. So I ended up being the first patient here to go on that therapy. That day was actually probably one of the most empowering days of my life, because that was the day I could start to take control back of getting, of my disease. Starting treatment, I think, is one of the most empowering things that a patient can do for their disease. So with that, I wanted to do more.
Yes.
I wanted to do something. I didn't want to just volunteer.
Yes.
And go ahead.
Yeah, and that was where we were headed to, Sonda. So just for listeners to understand, as well as viewers, there's over 1 million people in the United States, according to the National Institute of Neurological Disorders, who are diagnosed with multiple sclerosis, and it affects people differently and at different different stages of their life. And you were going there, you were making a great point about taking power back and that turning point 20 years ago. So sorry to interrupt.
Yeah. No.
Yeah.
So so that is really sort of the trigger of why it sort of determined the trajectory of the rest of my life.
Yes.
And that I really wanted to help and try to educate patients in order for them to get access to treatments. And then knowing there was one other treatment that was approved the following year.
Yes.
And sadly at the time, the information about MS was very, very negative. It was a very, it was Richard Pryor and Annette Funicello, for those of you who may remember.
Yes.
And they were very, very disabled from the disease. The majority of patients are not. The larger population are poor patients like me who, it looks invisible. You can't tell that I have a disease.
Yes.
But I still suffer from certain components of that disease. So that's again what started this concept of what can I do to educate that it doesn't have to mean a wheelchair sentence for everyone.
Yes.
And it doesn't have to mean disability necessarily for everyone. Kevorkian was also helping assist suicide at that time for very disabled patients. And so that was the image that as a 24-year-old, that's what I was looking at. That was my future. And I was, determined to try to figure out if there's some other way that we can, there's got to be more to this. It can't just be that's my fate.
Absolutely, Sonda. Sonda, your testimony is inspiring and it's encouraging. You mentioned a lot about education. Obviously, along with that education, there's some research that you've been able to do. So in reviewing your background in bio, it appears that you're a sound and great researcher, an advocate, as well as a champion. And that's been evidenced by the Multiple Sclerosis Center that you helped to develop and find here at Mind. So do you want to tell us a little more about the MS Center?
Yeah, so again, at the time, we were, this is a private facility.
Yes.
My unfortunately now late husband, who wasn't my husband at the time, but became my husband, and I had this sort of greater concept of what we could do. So created a support group to be able to educate people who are in a similar situation to what I was on, being young and, there's still hope and what can we do? And then again, we weren't in academia or hospital, and so it was absurd that a private DO facility is going to do research.
Right.
That was ridiculous.
Yes.
And we just dug our heels in, rolled up our sleeves, and said, I think we can do this. And the point of it, again, we're not laboratory creating molecules, but we are. Can we start at a phase where we can actually offer it to patients and give them options they otherwise wouldn't have? And so that's why we got into research. And again, we had limited therapies, right? There were three therapies approved by 1997, all suboptimal, and then we were able to get our foot in the door once we proved ourselves. Now I have the same molecules as the leading facilities in the world.
Congratulations there. And 3 therapies approved in 1997. So to date, 2021, it's at 23?
Yeah,
24?
we're like 22, I think.
Yes.
15 novel. Some are generic, some are offsets of other. But yeah, we've come a long way, but we don't have a cure. And interestingly, in the 90s, the cure was 10 years away.
Yes.
And here we are.
Absolutely.
But a cure is very complicated and it's very different, right?
Yes.
It depends on your disease state. It depends on a lot of things. There's a lot of focus on autologous hematopoietic stem cell transplants. That's for a very specific type of patient. That's something that we can't do here because we're not set up because we are a private facility. But again, a vaccine to prevent people from getting the disease in the first place, medications which do stop. We've done a really good job at stopping and slowing progression of the disease with therapies we have now, but there's risk with those.
Yes.
The more efficacious the therapy, the more risk there is. So we're always looking for what drugs can we, what drugs are out there that can potentially be high efficacy and lower the risk and be as safe as possible and tolerable for patients as possible. And compliance and adherence. We need patients to take their medicine. We need them to get on therapy. The sooner you get on therapy, the better.
Absolutely. Absolutely, Sonda. Wonderful. And we do want to obviously commemorate the lives of those lost to this illness, as well as bring forth some hope and encouragement for listeners as well as viewers, family members and caregivers, and friends who are currently impacted. With that being said, we fight hard, we advocate for those that are still here, we advocate for those who have transitioned on. So talk to me a little bit about your advocacy work, state level, national. Let's go there.
Interestingly, in the early 2000s, there was the first infusion drug that was approved by the FDA, got pulled from the market for a very good reason, because of a significant potential adverse reactions that could happen with the drug. But the drug was it was so powerful, it was so important to be able to shut down this disease that I felt strongly enough to reach out to the FDA, and I was able to speak when they were talking to bring the drug back to the market. I was able to testify both from a professional and personal standpoint about what this drug actually would mean for people's lives, and it's really been life-changing for them. And then from there, most recently, I've had the opportunity to, like you had said in the intro, testify to help pay, with infusion costs. So, trying to advocate for patients and doing the right thing. And thankfully, I'm in a position and I have enough connections now that I think I've been able to successfully do that. And the hope is that whatever else is out there, we've partnered with the MS Society. We have a renewed, really strong partnership with them, which they've had a sort of renewed outlook on how they're approaching patients with the disorder, which is very encouraging, because I feel like it wasn't that way, and so it's so with them, hopefully we can continue to champion for patients.
Wonderful. That's what it's about. Son, I have one other question for you, and the way that our interview is rolling out, we're getting all of this great research and clinical input from you, as a champion and a survivor, as well as a contributor to continuing to push forward to help others. With all of that being said, right, you've done so much in this space, so much for the community and Michigan, and then your impact nationally. What else do you see within your wheelhouse or within your bandwidth to be able to inspire more champions to continue to push and to fight?
For MS or just in general for anything?
Both.
So I mean, I'm a promoter of early treatment in terms of MS, and realize hopefully I can serve as an example of you can still do things. I deal with fatigue, chronic fatigue. There are invisible things that people don't see that take for granted because I look fine. And we actually did a documentary years ago called But You Look So Well. But it's really I think it's really important that the mind-body connection and early treatment and taking care of yourself, and you have to be your own advocate. Focus on what you can do, not what you can't. Focus on your ability, not your disabilities. And and again, mindset is a big part of it. It's not everything, because when you're but a lot of even my really disabled patients are the most inspiring. I have a young girl in our infusion center right now who sadly went blind. She was diagnosed in her teens. Sadly went blind. We had to use very aggressive chemotherapy on her because there weren't treatments available at the time that she was having significant issues. She's going through. She just went through breast cancer and survivor. And she's just she's in her 30s. She's married. She's just this incredible, inspiring young woman. And and she told me today, she's like, it's because you and Dr. Rossman made me that way.
So
I feel like that's good. If we can keep doing that, then we're doing the right thing.
Indeed, Sonda, indeed. And I'm sure it's not just that young lady that you've been able to inspire and positively influence and impact over the last 20 years. I'm sure there's dozens out there that you've been able to have that impact on.
I hope so, but if not, then I think everybody has that opportunity. It's within them to do it.
Wonderful, wonderful. Sonda, thank you. Thank you so much for giving a heartfelt testimony of your own personal experiences as well as your professional contributions. You know, we applaud and inspire that in any way that American Advantage Home Care can assist clients and the mind. We're ready to do so. Thank you so much,
Thank
Sonda.
you. Thank you.
As Americans, we're defined by our grit, our toughness, our excellence, and our multiculturalism. But here in Detroit and Southeast Michigan, we are battle tested. That's our advantage. We've been hit rather hard by the pandemic and other health challenges. Allow American Advantage Home Care to provide skilled home care services for you in the comfort of your own home. We are Joint Commission accredited and CMS certified. Call us today. Once again, this is Season 1, Episode 4 of the Home Healthcare Today show. Now we are sitting down with Sarah Johnson, a nurse practitioner here at the Michigan Institute of Neurological Disorders. Yes, Sarah is a board certified nurse practitioner who specializes in multiple sclerosis in the Mind's Comprehensive Center for Multiple Sclerosis Care. She completed a Bachelor in Science degree in nursing from Bradley University. Sarah does maintain national board certification as a family nurse practitioner through the American Nurses Credentialing Center. Sarah, welcome to our show.
Thank you for having me.
Sarah, please tell us a little bit more about yourself. In addition to my overview, where do you practice? What's some of your expertise from a provider standpoint? And then your passion for patients who are challenged by multiple sclerosis.
Sure. So to add on to my bio, I do have a Master's of Science in Nursing as well from the University of North Carolina. And I did specialize as a family nurse practitioner. And so I was board certified through ANCC. I am also a multiple sclerosis certified nurse, so that is an international certification.
Wonderful.
So I'm very proud of that.
Yes.
But I have been a nurse practitioner since 2005. I've been in neurology for about the last 9 years. I joined Mind in 2015, and I solely work in the Multiple Sclerosis Center.
Yes.
So that means I only help take care of patients with MS. I do work with two wonderful physicians who also see the majority of our MS patients, Dr. Belkin and Dr. Baduras.
Yes.
And we co-manage our patients here in the MS Center. We're very comprehensive, so pretty much anything a patient with MS would need, we have that here under our roof. We would prefer to see our patients here in our office rather than having them go to the ER or in urgent care.
Yes.
I am fortunate that I have longer exam times for my office appointments. So sometimes the patient will see one of our physicians, and it's a very overwhelming diagnosis.
Sure.
It can be a little confusing at times, and so the follow-up appointment with me, I'm able to spend a little bit more time to help educate patients, to help reassure them, and go over whatever aspect of their MS journey that we need to on that day.
Wonderful, wonderful. Thank you, Sarah. And just to reiterate, in view of your role as a nurse practitioner, we saw during the pandemic, the role of nurse practitioners and physician assistants became greater, or in terms of greater awareness to individuals about the role of nurse practitioners. So with that being a lead, please elaborate a little bit more about how you assist physicians in providing care for patients.
Sure. So the nurse practitioner physician relationship is a collaborative approach. So we work together hand in hand and make joint decisions. We have a very open communication here in our office. We really work literally side by side with each other. Anytime I have a question or concern about a particular patient, I have no problem talking to the physicians and vice versa. If one of the physicians saw a patient and they are going to add them into my schedule, they'll immediately say, Sarah, this person's coming in to see you next week, and this is what we need to talk about. Also, I do make independent decisions as well, so I can order diagnostic tests, lab orders, prescribe medications.
Yes.
But really, a big goal of mine is educating our patients. And I feel if we spend a little bit more time early on in their diagnosis, or if they're a new patient of ours, I think that helps over time. That helps them feel more comfortable with their disease, helps them get an understanding of what it is, and then they're able to manage a little bit better on home on their own.
Wonderful, wonderful. Yes, education appears to be a continuous theme, as this is Multiple Sclerosis Awareness and Education Month. So very, very good there. So in addition to educating, right?
Yep.
Educating patients, are there any other approaches or best approaches that you've seen to assist patients at multiple stages of the disease?
So I think the best approach to any office visit or any interaction with a patient is active listening, asking open-ended questions. I always start my exam with, how are you doing? Anything new or worsening since your last visit? And that just takes the visit from there. Sometimes I do then have to ask other follow-up questions, but I try to keep them open-ended to just allow the patient to just speak whatever their symptom or whatever their concern is at that moment. And just kind of feel the flow of the visit, read verbal and nonverbal cues. I think that really helps you know what you need to focus on for that office visit.
Yes.
And then the other best practice, I think, is empathy. Because many of these patients, as Sonda mentioned earlier, they're non-visible, and their family sometimes doesn't understand. Family and friends have a hard time sometimes understanding the disease, understanding the symptoms that they have. And MS is what I do all day long. I hear it, I understand it, and so acknowledging their symptoms is really important, and helping them feel that they're not alone. This is not abnormal. I believe you. I understand you. Let's figure out a way to help you get through this time.
Very good. So the compassion that comes along with care and empathy goes a very long way.
Yes.
All right. Sarah, we're going to take a quick commercial break to hear from our sponsor, and then we'll come right back and talk more. Thank you.
Thank you.
Spring is a beautiful time in Detroit and Southeast Michigan. American Advantage Home Care brings that energy, joy, and vitality of the season right into your home, coupled with skilled home health care services. Our world-class team of clinicians can help you to thrive, maintain, and rebound in the comfort of your own home. Finding a home health care agency more compassionate and caring than American Advantage Home Care is a long shot. Sarah, thank you so much again for providing such detailed insights and input from your position here at Mind. It struck me, your mention of empathy, listening to the verbal and the nonverbal cues, Mind being somewhat of an extended family member for patients and clients who are suffering with the disease. And then also being somewhat of a respite to families, right? To give family members the added support that they need. In view of that, as a home health care agency, we do take care of several patients who were diagnosed with multiple sclerosis and are struggling at various stages. With that being said, should families, in your professional opinion, should families or caregivers consider home health care as a means to help their family member or friend deal with multiple sclerosis?
Absolutely. I do think that home health care could be a great resource for our patients.
Okay.
Sometimes mobility is an issue, so getting a patient out of the home and into the office can sometimes be a big obstacle.
Yes.
Some of our patients no longer drive.
Yes.
Or there could be transportation issues. So for them to get the resources they need, whether it's physical therapy,
Yes.
occupational therapy, those are great resources provided by home health care that our patients do take advantage of.
Wonderful.
A few other aspects of home health care are skilled nursing,
Sure.
taking care of catheters or wound care, all the things that a nurse in the home could help a patient with is very beneficial. A home health aide also could be beneficial in certain aspects, helping with activities of daily living, bathing, dressing, and social work.
Yes.
There are a lot of resources in the community, and sometimes a consult social worker through the home health agency will help get those resources that those patients need.
Wonderful, wonderful. Thank you, Sarah. Lastly, as we wrap that up, because as an agency we do certainly provide all of those resources to not only our current roster of patients, but we obviously accept new ones. So thank you for that reiteration, Sarah. My last question for you, Sarah, because I know you got patients to go see and families to work with. Are there any other resources, clinics, specialists that you would recommend for viewers and listeners out there in Southeast Michigan?
Sure. We are a comprehensive MS center. I mentioned that earlier, that we do offer a lot of services for our patients, but definitely outside resources are definitely needed at times.
Yes.
Other specialty physician or specialty practices, we do refer.
Yes.
So ophthalmology, urology, dermatologists,
Yes.
sometimes orthopedics, rheumatology, other specialty practices are needed to help assess and evaluate our patients. Sometimes patients are able to get out of the home, so physical therapy and occupational outside of the home is sometimes very beneficial for our patients. I try to explain to our patients that it's a tune-up.
Yes.
Let's do the tune-up. They'll teach you the exercises to do at home. Let's look at it maybe once a year as a tune-up.
Yeah.
The National MS Society
Yeah.
website is a fantastic resource for patients. It has a lot of information regarding the disease, support services. It also has a very comprehensive, all the different medication treatments, because that can be very confusing for patients, and I think that's a neutral spot for patients to go to and look at the different meds and learn about that. So I think that's a great resource in our community.
Awesome. Wonderful, Sarah. Thank you so much
You're welcome.
for
Thank
all
you.
of those invaluable insights. We appreciate your work.
Thank you so much for having me.
Our pleasure. Part 3 of our meeting today with the Michigan Institute of Neurological Disorders involves the CEO, the newly appointed CEO, Mr. Kevin Browett. Mr. Browett has extensive operations and business development experience with a wide range of industries and great level industry knowledge. He has led startups, Fortune 500s, and has been a change agent when it comes to the healthcare model. In his role as CEO of The Mind, he is responsible for multiple locations, Farmington Hills, Madison Heights, and Dearborn. So 3 locations for The Mind. He also oversees the work of 25 providers. Now, just a little background on The Mind, once again, for those that are just tuning in. The Mind's extensive neurology-based service lines include MRI, infusion, pain management, diagnostic testing, as well as numerous specialty centers dedicated to specific conditions like multiple sclerosis, neuroimmunology disorders, Parkinson's disease, and movement disorders, Alzheimer's disease, and memory disorders, and migraine and facial pain conditions, just to name a few. Kevin is a member of the Cranbrook Board of Trustees, as well as a board member of the Business School of Duquesne University. All right. Originally from a one red light town in Pennsylvania, he resides with his family in Bloomfield Hills. Hey, Kevin, thanks for joining us today.
Thank you, Clem. It's a pleasure to be here.
Congratulations on your appointment, Kevin, to CEO.
I appreciate that. I'm now, I think, 7 weeks into the role. So.
Hey, 49 days, right? So how's that first 100-day list coming along?
It's been great. I mean, I had a desire to really be back in healthcare, and mine was the perfect opportunity. It's all about patient care, innovation, really making a difference for people's lives when it comes to healthcare, and that's what really drew me here. You know, I mean, my whole life has really been around trying to help other people.
Awesome. Wonderful, wonderful. And we appreciate that, Kevin, and thank you. Thank you for that commitment. And with your background and talent, you could have landed anywhere, but we're glad to have you in the great state of Michigan, for sure. All right, as we hone in on the mind, talk to me a little bit, Kevin. You mentioned that wellness and patient care attracted you and working to resolve some of the issues with the healthcare model. But let's hone back in on mind. Talk to us a little bit about the history, what you view as mission, vision, and then some of your current goals, and maybe even some of the challenges that you see.
Sure. Well, you know, when you think about Mind and the opportunity here, you have an organization that's been committed to the community, committed to their patients for over 50 years.
Yes.
So you take that history and how it evolved. It evolved around having the best practitioners. So you have 25 physicians that are not just locally known, but they're internationally known.
Yes.
You have the best of the best under one roof.
Wonderful.
And one of the things that really appealed to me here that I think was innovative, but really makes a difference when you're a patient and you're giving best patient care, is the idea of a one-stop shop.
Mm-hmm.
You come to Mind and you'll see a doctor who will then diagnose you, who will then send you for an MRI,
Yes.
who then will read the MRI, and next thing you're back with the doctor and you're actually getting the treatment. And that can
Yes.
all happen in one place and literally in a few hours.
Absolutely.
And that, when you're in pain or you're concerned about what's happening to me or my family,
Mhm.
that one stop, that
Yes.
ability to like connect the dots,
Mhm.
was just amazing for me. And that is part of the mission here. That's innovation, patient care, passion for making a difference in a person's life.
Wonderful, wonderful. Yes, Kevin. And when I think about that one stop, we're sure that there are a lot of patients out there that perhaps get frustrated, or families get frustrated with attempting to arrange visits and care plans with multiple specialists in various parts of Metro Detroit. But to bring it all under one roof and have 3 locations to take care of people is really great stuff. We're really encouraged with your colleagues and very inspired, you know, with through our conversation earlier with Sonda, as well as with Sarah. You know, there seems to be a compelling mission to help people and to help them physically, mentally, and spiritually as they battle. So this is really good stuff. Kevin, do you want to elaborate a little more?
And I think to that point, what really drew me here was the desire to take what's been built in 50 years
Yes.
and really carry it to a much broader community format. So, you know,
Yes.
our goals are in the summer of this year, we'll open a Roseville location.
Yes.
So there'll be a bigger footprint. And as we go forward, we'll expand to other communities around the Michigan market so that we
Yes.
can, again, touch those patients, touch those families, reach into the community, offer that one-stop shop,
Yes.
and continue to be the best, not just in Michigan, but ultimately in the whole Midwest.
Wonderful.
So that we can continue to give better patient care.
Absolutely. This is great, and very, very encouraging. It certainly is, Kevin. So in terms of that, you know, Roseville expansion, looking at other parts of the state in coming years, and then the region, how could collaborators, right? Because we understand that success is rarely achieved alone. A lot of research builds upon itself from multiple partners. How can others attempt to make a meaningful impact and and join you and your team in your mission?
Well, I think there's a number of ways, and you sort of hit the nail on the head. I love to build teams.
Yes.
Whenever I join organizations, and when you talk about a team, it's both an internal team, which means, we're looking for amazing individuals that are in healthcare that really want to be part of a growing organization where they can really join. If you're patient-centric,
Yes.
if you want to be with the best of the best in the country, if you want to really provide best services, then I'd say collaborate with us and join us as a member of the team.
Yes.
Then when you reach outside, where can we find more partners that as we talk about innovating healthcare in the community,
Yes.
and we talk about what really the impact of neurological services is, how can you and another organization partner with us, whether it's a major health system, whether it's an insurance plan, whether it's another provider of either products or services. I open my door. I want to hear from those individuals. I want to partner with those individuals, and I want to find a better way to service patients.